Hello, Dr. Robert Arnone, upper cervical specific doctor, also known as the brainstem doctor, here to talk with you today a little bit about seizures and epilepsy. First thing I want to explain is there could be many different causes of a seizure, and so we first want to kind of try to figure that out. Typically we're going to do some tests. Usually there's going to be testing of the head, like an MRI is pretty common test to start looking for to make sure there isn't anything else there. We want to first rule out things like a brain tumor, brain infection, stroke. Once those are ruled out and a person is having seizures, and once they have more than one and they start to become more of an occurrence, then we're leading more into epilepsy diagnosis. Now there's many different medications that can be used that could help maybe minimize the seizures and such, sometimes possibly even prevent them to some degree, but here's the thing. You want to understand that the basic cause is the problem with the electrical activity in the brain. It's an abnormal activity, it's abnormal brain chemistry, and so this is the cause. Okay, as a brainstem doctor, I'm the doctor who looks at the brainstem itself, the function. Is it proper or is it thrown off? Is it being choked off? Is it functioning correctly? Is it not? I can tell you that. And that is what feeds and supplies the brain. And so many times a problem here could be affecting higher up. And taking different types of medication, like I said earlier, it may help you some, but if it's not correcting the cause of the problem, it's just kind of covering it up or masking it, and the problem still remains, so we still have trouble as we go on. That's obviously not going to be the best way. If you're somebody looking for a better way, we can see if we're a good fit. We can see if I can help. If there's an injury here, if there was a fall, if there was a birth injury, head injury, concussion, sports injury, car accident, many different reasons, but basically we've got misalignment in this upper cervical spine, could be off by a couple of millimeters or so, and basically that's enough to put pressure on that brainstem, alter blood flow and nerve flow up to the head. And so if that's going to be corrected, you would have to fix this first. So therefore we recommend, after testing to find out and rule out, like we said earlier, the brain tumor, the brain infection, the stroke, the next step is to come to a brainstem specialist to come out to see me. I'm Dr. Robert Arnone. I practice in St. Charles, Missouri, about 7-8 minutes from St. Louis Lambert Airport in St. Louis, and be happy to talk with you, take a look at films, take a look at you, and see if we can help. All right, so reach out, put a comment in the video, in the box associated with this video, and we'll see if we can talk and if we can help. Until then, take care and God bless.